Hi, my name is Bridget Richardson. I'm the Assistant Director of Ecumenical and Pastoral Initiatives at the Nesty Center for Faith and Culture at University of St. Thomas in Houston. And I'm here with Dr. Brian Reed. He's the Chair of the Clinical Sciences Department at the University of Houston College of Medicine, the Board Chair for Doctors for Change, a practicing family physician, and also on the advisory board for the Nesty Center for Faith and Culture. So Dr. Reed, thank you so much for joining me today.
Oh, thank you for having me. It's really a pleasure to be here.
Yeah, we're going to get into health disparities that are in the Houston area and also touch on the pandemic. So maybe you can just start us off with a little baseline of what some health disparities are, your work, and your connection to the Houston area.
So as a family physician, many of us think about what ways in which we can improve the lives and well-being of the patients that we're seeing. It's not just enough for us to, say, prescribe a medication. We really want the patients to get better. Ideally, when we do some sort of intervention, or when someone comes into contact with the healthcare facility, ideally it would lead to a longer, healthier life and a better quality of life. And unfortunately, throughout my career, even in the city as great as Houston, or county with Harris County, we see that not everybody's able to experience the same levels of quality life or the length of life. What we found is over time, people have started to think about this idea, this concept that your zip code may in fact be more important than your genetic code because of such differences in terms of life expectancy. We see that within a couple of miles, the average life expectancy may be a difference of 10 to 15 years. Interestingly enough, if you look at the city of Houston, because and really Harris County, they've done maps. These are sub-county average life expectancy maps. They look almost like a reverse C in the sense that the west side of the county, people tend to live longer, healthier, more productive lives than those on the east side of the county. So we talk about like sort of the Ship Channel area, kind of going around Pasadena. If you compare that to like Katy, of course, Westview, River Oaks, places where you find more affluence, individuals there are living well into their 80s, where some of the less fortunate areas of the county, people are living into their upper 60s. There's a huge difference in life expectancy within a pretty close geographic proximity. This notion of sort of health disparities has gotten a little bit more traction lately with the Covid-19, when we've seen sort of disproportionate individuals of Latino or African-American descent dying from it. But all it's really done is sort of expose some of the underlying health disparities that we are aware of. Now, there's several physicians here, several organizations that are sort of dedicated to trying to combat this or address this. Many of them are working within the different safety net organizations here in town. And those would include, say, your Harris Health System, several of the federally qualified health centers like Hope Clinic, Legacy, Vecino, El Centro de Corazon, Spring Branch FQHC, Lone Star Circle of Care, Be Busy, and there are others, or some of the charity clinics like Ivancina, San Jose, or crisis clinics. So all of these organizations are trying to do more, but there's just such need in this area that even with all these teams of doctors, and we're talking hundreds of doctors working in these safety net organizations, it's still not enough.
And I hate to ask such a basic question, but why? Like, why is the need so high? Why are these problems so deeply rooted in, the Houston area?
Yeah. So we used to think of this as being sort of ground zero for uninsured, and it is. And unfortunately, we have, in the nation, we have the highest rates of uninsured individuals or underinsured individuals. And when we think about sort of health outcomes, what sort of determines, how long someone's going to live and what sort of quality of life they're going to have, only a small percentage of that is due to the medical care that they receive. Some models have said it may be only about 10% or 20% of the healthcare access or healthcare that they receive is going to determine sort of how long they live. A much bigger factor is going to be behavior, you know, smoking, alcohol use, lack of physical activity, poor diet. That's going to account for about 40%, those health behaviors. Genetics is going to play a role. Unfortunately, people do inherit certain illnesses or diseases from, just kind of runs in their family. Environment, sort of unsafe, unhealthy environments can also be a factor. And then there is some socioeconomic status too that plays a role in it. So for us, we have a large population of individuals here, many of whom, because of sort of health policies, we don't have many people involved. The thresholds for being enrolled in Medicaid, for example, are much lower here than, say, in other states. You can earn more money in other states and still qualify for Medicaid in other states, whereas here in Texas, it's pretty low. And we did not expand Medicaid with the Affordable Care Act. And, when you put those things together, that's part of the reason why we have the sort of levels of health disparities here and challenges. I mean, even in a county, if you live, say, like in Fort Bend County versus a Harris County, because there is no Harris Health system in a Fort Bend County, your ability to access a hospital like a Ben Taub or a county clinic is reduced. I mean, they just don't have the infrastructure there. So, you could have someone with the same amount of income living in Fort Bend County, but there's just no programs in place as they do in Harris County. So.
And is that why y'all look at it by zip code and area? Because that differs so drastically?
So I think the reason why we look at it by zip code is we were able to get sort of data. It's sort of tied to birth certificates and death certificates. So it's easier just to link. We've got, these, people born here in this zip code, and then, the average age of people dying. But we know that these neighborhoods are vastly different too. Some places they have sidewalks, they have parks. It's much more amenable for people to kind of go outside, walk, and exercise than other areas where there's no sidewalks and, stray dogs. There's no grocery stores in certain areas, where in others there's, multiple grocery stores around. So all of these sort of things in which the neighborhoods are planned and developed, they lead to, these outcomes. They do impact people over time. So, for us as physicians, I think, part of me as being a family physician is really, it's taken me time to understand that, okay, yes, I'm treating this person with high blood pressure, and these are the recommended medications, but I've got to really sort of think about health happens where people live, work, worship, and play. And my neighborhood isn't necessarily the same as the neighborhood in which the person that's right across, that I'm looking at. And I've got to think about that. I've got to think about other possibilities as I'm sort of giving them this advice. This is the way that you should eat. This is the way, hey doc, there's no place for me to buy that food in my area. So we've got to come up with a, mutually agreeable plan, something that, not that I'm just prescribing to them, but something that's going to be feasible and something that's going to work for them in their lifestyle.
And how do you, because I know so much of who you are and part of your mission is to educate people about the underserved, how in you just adapting the style and the recommendations that you give to someone could change the whole outlook of their life? Because I know, people have a tendency, like if they can't do something, especially health-wise and medically, they throw their hands up like, oh, I can't work out this morning. I don't have time. I'm not going to do it. Or at least, that's the way people think. So how does that carry out in your vocation to serve the underserved?
So, I mean, that's a very good point, because I think it is very frustrating. I know I've had patients tell me, that sometimes they're afraid to see me because, they think I'm going to beat up on them, or I won't understand them, or, maybe they'll just tell me what I want to hear rather than tell me the truth. So I think it sort of, it kind of goes along with the, sort of the theme that we have for the Center for Faith and Culture. It is that we have to really dialogue and have to seek understanding. And that, yes, I'm a health professional, but my position and station here in this world is no different than you. And I'm just human like you. My job is here to help. And the only way that I'm gonna really be able to do that is to understand, more about where you're coming from, understand more about your life, and relate to those experiences, and really treat with compassion and empathy. True, may not have the same struggles that you have, but I can at least empathize with that. I can understand that. And, together with that sort of understanding, we can devise a plan or devise something that'll work for you, or I can get you the appropriate help. Maybe my top priority is dealing with the blood pressure, but because you're so stressed out, you can't even think about that. So let me get you connected either with a behavioral therapist here at the center or somewhere else, or get you connected with a faith community, someplace where you feel comfortable sharing. There is help for you out there, and there are people that care for you. A lot of times when we're working at these facilities, and people have encountered so many, negative things in the world outside of the clinic walls, that, I make it, my mission to not have a bad day, not take out whatever's going on in the back of my head, on, whoever's coming, if the patient's late or whatever. I forgive that, because I understand there's different circumstances, different struggles, and you took whatever, you went through whatever you had to get here. I'm here, I'm available. Let's try to make the most of this time together and get you the help that you need. So, that's I think the underlying premise is really to try to get a more understanding of where the patients are coming from. Understand that, within this 15 or 20-minute visit, I can make so many recommendations, but to really make an impact, I have to understand what happens in the 3 or 4 or 5 months between this visit, what happens in the world around you, and take that into consideration. And I ask them to share those things with me.
And how have you been treating or seeing patients during this time of pandemic and adapting that ethos to the way that you're interacting with them, knowing they may be anxious, they may be ultra stressed, or they may be more sedentary, things like that? How have you had to adjust what you do?
Yeah, this has probably been the most challenging thing I've ever seen in my career. So initially it felt like, and maybe still is to some degree, that the patients were afraid of the physicians or the nursing staff or the medical staff, and we were afraid of them. So, it's hard to have a relationship when we are both sitting across the room like, what's going on? Am I going to catch something from you, or are you going to give something to me? I've treated tuberculosis in the past. I've, put gowns on. I've been around illness, but this is really sort of the first time where we've really had such fear and been like, okay, do not come out the house. Do not come to the doctor's visit for something so trivial. Okay. We will try to manage you at home. We'll do it telephonically, or, we converted to video visits to try to keep patients at home. And unfortunately, for me, the video visit just did not lead to that same level of connectivity. Sometimes I guess patients' bandwidths were not the greatest, or I'm, maybe looking at somebody's eye because they're holding the phone up a certain way. So you just miss that sort of level of connection, that same sort of connection. So it's been a challenge. I have seen a lot more anxiety. But I think it's easy to relate because we're all going through it at the same time. I've had anxious moments in my household. So I think despite that, despite this sort of challenge, we were able to find, common experience or common understanding. It's really easy to relate to someone that's anxious today because of this. So, sometimes I tell them, well, we just need to turn off the news, And I do remind people it is safe to go outside. We tell people that, it's open air. So please take advantage of this time and walk. I think one of the blessings that I've personally had is I've been home a little bit more with my children. I've gotten home earlier from work, leaving the clinic because there has been light traffic. So um, my boys, they're teens, and they were both on the track team, and unfortunately the track season got canceled because of this. But we would find our way to a track and would run together at night. I mean, of course, they're running a lot faster than me. They're doing their track workouts, but this was time that I probably won't ever have again with them. And I just sort of ran around the track, just jogging, just doing some distance running while they were doing their track workouts. But, I never would see them in practice, in the past, and would barely make it to a meet because of just the timing of them. So, this has been, a unique time for us together.
Yeah, that's great to tie it into the family. And how much do you think even that connectedness to family has an effect on your health, your mental health, your spiritual health, as people are trying to process this time?
Well, in an ideal world, and ideally you have good relationships with your family, and it's not a source of stress. So for me and my household, I mean, it's been a blessing, and it is. Um, Much of what I do ultimately is to try to support the family and be a good role model for my children, and provide for them the best that I can. So this time with them, again, it's just, I think it's helped me, and helped keep me also grounded. I mean, it's really sort of interesting how now that we're working so much from home, work is it's hard to set boundaries. It's kind of infiltrated the office and life, but at the same time, having them around or being around them has helped me too through this.
Oh, that's awesome that you do have that time. And just one final question for you. There's always a lot of information out there about health and what we should be doing and what we shouldn't be doing. And do you have any resources that we can link to in our description or share with people from your experience and your connections that are good resources to go to and say, okay, check this website about some best practices, or go here to find more information?
So we're fortunate enough living in Harris County. We have two of probably the strongest local health departments in the nation. Actually, both of them have been recognized, I want to say within the last 5 years, as being the top, health department in the nation. So Harris County Public Health has an outstanding website that has a dashboard that features all the numbers of coronavirus or COVID-19 cases, as well as resources for both businesses as well as public, just everyday citizens. There's also readyharris.gov. That is a website that we use really sort of anytime there's a crisis. So they tend to activate readyharris.gov if there's like a hurricane or some other massive flooding. And right now, that's a resource for where to get tested, as well as some information about COVID-19. Another resource is the City of Houston's health department. So they have up-to-date information about keeping individuals safe. And then for those that are really kind of trying to figure out what's going on in terms of our hospital situation, do we have beds, and what's happening in the region? We have the Texas Medical Center, the world's largest, and their website, tmc.edu, actually has a daily update in terms of how many beds we have available, how many people are in the ICU, how many people are on ventilators, and all that. So, I mean, I think when we talked about, sort of the social distancing and everything, we by the time we got into our community, we knew it was too late. I mean, we at that point, I mean, so from a public health standpoint, ideally, you would have kept it out completely, kept it over there, and we would have been able to live our lives. But clearly, that unfazed by this, but clearly that ship has left the port. So then we go to mitigation. How do we keep as many of us healthy, safe, and alive. So that's where all the sort of social distancing, as painful as it has been, and closing has been, just to be sure that we didn't overwhelm the system, and that if people were to get sick, that there would be places for them to go to seek care. I mean, this is, in all honesty, this is just sort of basic common sense. How do we keep well? And if someone's sick, yeah, you stay away from them. And with this, unfortunately, with this disease or virus, oftentimes there's a period of time in which people can pass the virus without being symptomatic. So you don't know they're sick, they don't know they're sick. So that's why we've had to institute such drastic measures as closing businesses and telling people to stay at home, because we just did not want people coming together who may not even be aware that they have the virus. So now going forward, as we reopen these businesses, we have to use the things that we wouldn't typically do to keep ourselves well. Good hand hygiene, washing our hands frequently, much more frequently than before, cleaning commonly touched areas. The mask actually does help. I mean, they've shown that. I know as people don't like to wear masks and don't, but it helps keep us safe. I mean, it helps me prevent spreading it to someone else, and also someone spreading it to me. I mean, it's been proven effective. And then there was recently an article just talking about, distance that respiratory droplets fly, and the coughing, the sneezing, the singing. I mean, actually that choir that got sick, they thought it was the singing because you're projecting so much. So, that's why 6 feet is helpful. Actually, if you're doing things where you're shouting, yelling further, it would actually be probably better because the droplets fly. So.
Yeah, just one final question, because you've piqued my interest in it. What can you say about the common good in terms of our health, like the health of all of us as one, because you're touching on some really interesting topics, and especially in our culture today, like some people are against it, some people are totally for it, and there's this chasm sometimes, and when they try to dialogue, what can you speak to about these health practices as an effort for the common good?
So, in all honesty, when we before we even got to closing down businesses and closing down the rodeo, those of us that have had some experience in public health kind of said, if we did these sort of things during flu season, we'd have a lot less people getting sick. People stayed home when they didn't feel well. If people washed their hands and just were more conscientious of, the potential harm that they could cause to somebody else, we wouldn't even have as many flu cases. I mean, these sort of actions are the same things that we do for really sort of any sort of contagious thing. So, these sacrifices that we're making in this particular situation is because it is new. We don't know how deadly it is, and we don't know who's going to be affected. I mean, I know early on people were saying, it's only 1% or 2%, so most people will do okay, but we don't know who's going to be in that 2%. It could be me. It could be you. It could be my mother. It could be my brother. So that's why we take these steps, because at this time, we really cannot predict or tell, who's going to be adversely impacted. And, and the people talk about, well, flu season wasn't so bad at this. I'm like, this is new. 6 months ago, we had nobody dying from coronavirus. I mean, that's what's sort of scary for me. I mean, so in addition to everything else that's killing people, now we have this new thing. So, we're all linked. And I think part of the pain with this is that we don't do too well when we're not together. Social isolation is, it's a challenge for us. I mean, we are social creatures. We do much better from that whole idea of living longer and living better when we have supportive people around us, when we have good health, good families. We do better when we have communities of faith, when we're interacting in communities of faith. We as individuals do better. So staying away from loved ones it's usually not too good for us. But, in this case, it's a sacrifice, a temporary, a painful but temporary sacrifice that we're trying to make to ensure the, safety and well-being of others. But, for us, you know, the sooner we can get back together, I think that, we'll thrive together, thrive better.
Well, thank you so much, Dr. Reed, for this conversation. It's been a real joy to talk to you today.
Well, thanks for having me. I really appreciate it.
All right, and you have a good one.
All right, you too. Take care.